Welcome to Ascension Saint Thomas. I'm one of the physical therapists that work here, and we're going to go over some things that you should focus on for your hip or knee surgery. All of it should be in your hip and knee booklets, including your exercises. Really, the goal is to do these exercises twice a day, 10 to 20 repetitions, and I recommend that you do them on a bed or a couch. I think it's just a lot easier than getting on and off the floor. So we're going to go over these exercises, and these are going to be the ones that you do before the hospital. Once you have your surgery, these are going to be the ones you do here. And if you do your outpatient or any other further therapy, these are the ones that we recommend that you follow up with after the surgery. So don't quit them once you have the surgery. First one we're going to start off with is the ankle pump. So the goal is to flex and point your ankles as much as you can, 10 to 20 repetitions. So again, taking your time, not just a wiggle of the toes. It's truly a pump of the ankle. The next exercise you're going to do is called a quad set. You're going to press your knees down, flat as a board. Hold it for 1, 2, 3, and then let it completely relax. Again, 10 to 20 repetitions. Sometimes you can even put your a little towel roll or a little pressure. Again, the goal is to get the knee as flat as you can get it. Your next exercise, glute set. You're gonna tighten the muscles of your buttocks, tight as you can potentially get them. Hold them, 1, 2, 3. It's like you're lifting your hips off the bed without. Your next exercise, heel slide. You're going to bend your hip and knee, slowly sliding your heel back toward your bottom. You're gonna go back and forth and then take your time. Again, right out the gate after your surgery, your hip and knee may not bend like this. So just take your time, do the best you can. Again, the goal is to do these exercises on both legs, so make sure you don't forget your other side. We want both of them to look just great. If this is your surgery leg, for straight leg lift for your knee surgery exercise, you're gonna flex the heel, you're gonna tighten up the knee, and you're gonna lift your leg. This is your straight leg lift. Try to aim for the other knee height and make sure that you relax the leg on each repetition. Take your time, this one's a hard one. For your hip surgeries, you're going to relax, keep that left knee bent up or your opposite leg. Take your leg out to the side, almost like a windshield wiper. Nice and easy, nice and slow. Again, another challenging exercise, but take your time with it. Try not to lift your leg off the bed, but it's truly just a slide on the bed. Another great exercise, bend both of your knees, Amelia. At the house, if you do not have a bolster, you can just take a rolled up pillow or blanket or anything that can go right under your knees. So let your knees rest on the roll. And your last exercise, straighten out the leg, straight as a board, hold it, and then let it gently go down. You should feel it into the thigh muscle, and just take your time, do the best you can. Good? All right, we're gonna slide this out. Your book may have additional exercises for your hip or knee, and just make sure you follow the guidelines set by your surgeon. Again, the goal is to walk a couple of times a day, ice a couple of times a day, and I think it would be great to do them after your exercises. Another piece of advice, something called a surgical kit or a hip kit that you can find online. It really does help with your bathing and dressing task, and it really can benefit you being independent and doing for yourself after your hip or knee surgery. So one of the things that I like to feature is something called a sock aid, because Shoes and socks are so tough after the surgery. So your support person may help you get washed up, get dressed after the surgery. But if you would like to do it on your own, this is a handy little tool. So what you'll do, you have your trough, you'll put your sock right over it. Try to get the sock right up to the edge. You're gonna take the ropes and place it on your surgical leg. Pull the ropes up with you as you go. It really does make things a whole lot easier. And if it doesn't get up all the way, you can use something called a reacher that's in your surgical kit to help pull it up. And you can just kind of use the little grabber pieces. All right. Good luck to you on your surgery. We hope that we get to have a great time with you.